Now I will start the next session. Thank you. Next session is the director of the disease control, the emerging infectious disease and zoonosis. This is from Myanmar, Ministry of Health and Sports. So she has been handling this COVID-19 pandemic since the very beginning until now, integrated with the so many multi-sectoral collaborations. And she's the spokesperson, focal person of the Ministry of Health in Myanmar. And I invite her to share us her experiences. So Dr. Khin, please.
Hello.
Yes, I can hear you. Yes, can hear you.
Yes.
Yes. Good.
Can you see my photo?
Yes, you can. We can see your video as well as your slides also.
Okay.
Slide also.
Okay. Okay. Good afternoon. I am Dr. Khin. I am from Myanmar. Previously I was assigned as a spokesperson for Ministry of Health and Sports Myanmar regarding COVID issue. Now my information team is upgraded and our Director General headed by our team, and I'm taking care of our surveillance, media surveillance, and the session for the latest literature to the higher senior official, including Junior Minister for policy to decision. Now I want to present situation update of COVID-19 in Myanmar and response activity. Next slide, please. Yes, this is a COVID-19 confirmed cases and death by states and region. And the first case was March 23rd, 2020, and up to from 23rd March up to now, there are already 287 cases. Most of the cases are from the Yangon. Yangon is the old capital city of Myanmar. There are altogether 201 case, not 201 case, and the death is 5 deaths in Yangon region. There are altogether 287 cases, but we recovered 200 cases. That is 70% of the confirmed cases. Next slide, please. Yes. This is the summary of active case, recovered case, death case. There are altogether amount to 87 cases. Active cases 81. There is 28% recover, 200 nearly 70% recover, and that is 6. Or case fatality rate is 2.1%. This is a slight lower comparing the overall fatality rate. This is the COVID transmission. There are a majority of the cases are from imported cases. Majority are the local transmission. This is the 160 cases and 56% of the total confirmed cases. Only 44% cases are from the imported cases. Next. Next, please. Yes. Yes, one research about their traveling history of confirmed imported cases. India is the most about the 46 case from India, and Thailand 26, and Malaysia 18, and Bangladesh is now 6 case and 6 case, because during this time we have problem coming back from the Bangladesh, and there are positive cases. There are 9 positive cases in Rakhine state. Next, please. Yes, when we analyze the confirmed cases, surprisingly, their asymptomatic case is 157. This is the 55% of the total confirmed cases, and symptomatic case is only 43%. And pre-symptomatic case, symptomatic after confirmation is only 6, so 2% of the total confirmed cases. Next, please. When we analyze the symptom, of the confirmed cases, most of the most of the patients come from cough and fever. There's nearly 60%. And surprisingly, we have the loss of taste and smell. Taste and smell, this is 70% of the all confirmed cases. And, and we noticed that the person coming from the UAE suffer from diarrhea, and they have the GI problems. And when other persons doesn't complain much of the GI symptom, they present as fever and cough, but coming back from the UAE, all the confirmed cases from UAE suffer from GI symptoms. This is a surprise finding for us. Next, please. When we analyze cases by age group, most of the cases are from the working age group, around 35 to around 19 to 35. The working age group, and male is more prominent than female. Next, please. When we search confirmed case and date of the left confirmed, there are imported cases is 127, and local transmission is 160. So this is the confirmed cases from country by country. Next, please. Yes, regarding the community response to COVID-19, we make fever surveillance at the point of entry at the international airports, seaports, and ground crossing points using the health declaration card. And we made fever surveillance at the community level, at the surveillance by basic health staff in the community, and fever surveillance of returnees from affected country at the community level. This is the major challenge for our country. There is no other country like us. There are a lot of returnees coming back from our country. Dr. Aunaiso already present this condition, because we cannot avoid this situation, because they are our citizens, so we must accept. So we make many preparation to receive and to make safe for all people. And fever surveillance at the workplace, and develop fever surveillance guideline by that we develop surveillance guidelines step by step. Next, please. This is the fever surveillance site. Next. Next. Yes, regarding community response to COVID-19, at first we made containment strategy of isolation of the confirmed cases, and quarantine of contact person, and quarantine of the international travelers, and contact tracing using the web-based application. That is the early search application, so that we can easily search who is the contact person and who is the most likely person that we can know by doing this application. And community-based facility quarantine, and this is the place where we can receive our returnees. Yes, next, please. We make the testing strategy of the first main is the testing of all contacts. The testing of all contacts. So there are 3.3% we can contact from the contacts of the confirmed cases. The second is the suspect case, person under investigation. We make testing of the suspected cases. This is 1.1%. We can find 1.1% of the positive cases from suspected cases, and that one is the testing of the volunteers. So we can find 0.22% of the confirmed cases from the quarantine site, and testing of healthcare workers and volunteers as well. Next, please. This is the new lab new lab public health laboratory. At first we have no WHO lab, but we can make national health laboratory as a testing for the COVID-19, So after that, we can extend the public health laboratory Mandalay, public health laboratory Molamyang, and we plan to extend the lab facility at the Taungji and the Lasho. This is our next plan. Next. Regarding community response, we make travel restriction. We suspend the arrival visa and we restrict all international flights and vessels. Regarding the health education, we at the community level, by using the IC material, we make health education to the community from the social media, Facebook, newspaper, radio, TV, and from the public announcement using the handheld speaker 5 times per day, so that everybody can know, or everybody can hear frequently, so that they can know the disease.
Hello.
How can it? Hello.
Okay.
Yes.
Okay.
Yes.
Okay.
Okay. Travel regarding the travel restriction. Yes, this is finished. Next, please. Yes, we make the hospital preparedness at the tertiary level up to the township level. At first, we have 3 designated hospital for COVID. Now we expand all tertiary level hospital up to the township level, so that we can receive and we can care all the confirmed cases. We extend the isolation wards. We pile up the medicine, oxygen, ventilator as well, and we develop clinical management guidelines. We guided up to the latest information, upon the latest information. Next, please. At the individual level, we isolate the confirmed cases and quarantine of contact person. If the 6 person stay at home, not go outside, and social distance at the public places. And we make we make mass gathering of the public area. We ban mass gathering with our leader Daw San Suu Kyi, headed by the committee, and they decide the policy. They give the decision to the states and level, and from this committee ban the mass gathering of public events and religious events, and stay-at-home measure at the most affected area. At first, three townships at Yangon, now 10 townships at Yangon, and 1 township at the Khin state. And we restrict gathering at the restaurants and follow take-away measure. Previous, please. Previously, yes. We close the school, training, and cinema, and social distancing. We ban the social distance, or we make social distancing at the public area at first 3 feet, and now 6 feet. And we restrict travel within the country, especially from the most affected area, and enforcement of communicable disease law. This is the very important. We have the communicable disease law, and our unit, Central Epidemiology Unit, draw the law comprising of all the sectors. This is the very important, but the latest law is not approved yet. So we use the 2011 communicable disease law, and then we have the disaster law, so that by using this law, we can manage the people who, and we can alert the public. So if they break the rule, they can be jailed. They can be jailed, something like that. And health education for social distancing using IC material and social media as well. Next. We publish the Myanmar situation report daily update. We update it daily, and it contains a lot of the world information, Myanmar information in detail. And we make the poster of how to stay safely in our home, and what is the preventive measure, what are the important points regarding this COVID-19, something like that. Next. Yes, this is the Myanmar dashboard. We made it very early very early, since I think very early, since February, I think we made it so that we can see easily how many people are affected, how many tested, how many positive cases, how many deaths. There are altogether to the 9 deaths in our country. Yes, next. Regarding wrong information and rumors and social media, this is very important because if the person is making the wrong information at the social media at Facebook, we inform to the Myanmar Facebook team when we have close collaboration with Myanmar Facebook team, and they make action suddenly so that wrong information, rumor verification, we can handle very well. And there in the Ministry and Health and Sport websites and Facebook page, we update daily news and update regarding the COVID and on the right time. And we have rumor surveillance team. Even state councillor also participated in public engagement in the response of COVID-19 outbreak. This is very important for our people because many people admire her. So if she talk to do like this, not to do like this, so people are ready to go along her leadership. So this is very much important for our community engagement. Next, please. Yes, this is our MOHS Ministry of Health and Sport websites and Facebook page, and we also announced you have to know this, like this. Oh, now this is the seasonal flu season. Season in 2019, we encounter seasonal flu event, and we lost 128 deaths regarding seasonal flu. So we announced that this is the differences between the COVID-19 and seasonal flu, and what we have taken, what we should take in, what we take care of, something like that. This is our MOHS website page. Next. Thank you for your attention.
Thank you very much. Thank you very much, Dr. Khin, for your very clear and overview and also the detailed presentation.